Hi, my name is Dr. Benji Schreiber. I'm a consultant rheumatologist. I'm often asked what I think about chiropractic treatments, spinal manipulations and mobilizations and adjustments. And I see there's a lot of activity, particularly on YouTube, where these videos really are very popular.
Ooh. Oh.
Yeah.
Oh.
We often see in rheumatology patients who've got spinal stiffness and pain, and people are often looking for treatments, and that includes chiropractic and osteopathy. So I'm asked what I think of spinal manipulation therapies. These are therapies that are classically done by chiropractors, but also by osteopaths, and occasionally by physiotherapists. And it's important to understand what we're talking about. It's very common for physiotherapists, for example, to prescribe exercise, to give advice about posture, and to do some deep tissue release work. Osteopaths tend to work in a slightly more manual way to do deep tissue release, and they'll sometimes do a little bit of spinal manipulation. And chiropractors tend to be at the end of the spectrum, doing more intense types of adjustments to the spine, and you'll see some examples on YouTube. Often people think of this, or they particularly focus on the cracking noises that can accompany some of these movements. And in terms of the terminology, these adjustments can be mobilizations or they can be manipulations, and the terms have slightly different meanings. So that a mobilization tends to be a smaller movement. It can be small or large, but it tends to be a movement that's within the range of that joint and is a lower velocity. It's not a fast movement. It tends to be a smaller movement, tends to be a softer movement, not so fast, and within the normal range of the joint. And that's a mobilization, whereas a manipulation tends to be a larger movement and a faster movement. And that's where you see chiropractors in particular holding a joint, often the neck or low down the spine, and as you'll see they can do it with most joints, at the end of its range of movement or very near to the end, and then doing a short, fast, small additional movement, which is often associated with a cracking noise due to a cavitation effect as the joint comes apart and then it comes back together in a very small way. And it's not really understood how this is meant to help the tissues. The two main models of hypothesis are that this is either doing a biomechanical effect on the tissues themselves where they are, or a neurophysiological effect, that these manipulations and mobilizations have an effect on the nerve endings. People ask me what I think about the safety of spinal manipulation therapies. Let's just have a little look at some of them, and you'll see why I do have concerns about some of them. Okay, so look at this one. You see he's using huge amounts of forces with a strap, pulling on the neck, and then a very sudden and rapid movement, which is really fairly aggressive in the neck. The concern about doing manipulations of the neck is the important structures that pass there. If we look at this next one, we'll see again straps being applied to the neck and then very rapid forces. There we go. Now these, and you'll see a couple more as I talk about it, these have occasionally been associated with devastating side effects. The vertebral arteries can dissect, and these are arteries that pass up in the neck, at the back of the neck, to the brain. And there is some evidence that these kinds of rare strokes that can occur in young people are sometimes caused by manipulations such as these. There are also other things that can occur with such movements, particularly in the neck, and that's around damage to the nerves. Disc prolapse can occur, and occasionally other specific problems. So which discs, bones can fracture, and you can have bleeding and other occasional side effects. These are young, healthy volunteers or participants, but older patients may have osteoporosis, may have rigidity due to arthritis, and so I think we really need to be very careful about these sorts of intense movements. So that's the intense movements at the neck with this Y strap, which is really a very intense. The neck is often a source of stiffness and of pain, and patients often want their necks treated. In this next group of videos, we'll see practitioners doing manipulations on the neck without the use of additional equipment such as the Y strap. Let's look at this first one. See, he's got the neck in extreme rotation, and there's a short, sharp movement with the hands. Doesn't look as vigorous or as scary as with the Y strap. And it looks like that's really well controlled. Again, in this young woman, pulls the head up into extension and rotation, and then a short, fast movement. She seems to be tolerating it okay, but again, would want to be slightly careful about making these rapid movements at the end of the range of movement of the neck. And here a child.
Good boy. Stay like that for
Young
me for a minute.
child. And again a sharp
There you
movement.
go.
These are smaller, gentler movements. They're probably mostly safe, but we need to be careful, particularly with older people, more fragile necks. And as I say, occasionally, even in young people, the arteries and necks can get dissected. That's when there's a tear in the artery, a bleed into the wall of the artery, and that can block off circulation and cause a stroke. Those kinds of complications are very rare, but they have been reported, and occasionally even death can occur. Now we're going to look at some treatments in the spine. I'm much more relaxed about treatments that are below the neck because the spine is much better supported, the arteries are much less likely to get damaged, the discs are less likely to be prolapsed, and I think here the chances of causing serious damage are really much lower. Let's take a look. Okay, so here we can see he's working on the lower spine, applying pressure from the side. Now this one
Whatever you do, try not to sneeze.
looks a bit scary with a hammer and a large rod, applying pressure in a very well localized area. And of course you just want to know that this pressure is very gentle. This might be able to relieve some pressure around facet joints, for example. I'm sure there's all sorts of other mechanical explanations that a chiropractor will give you.
Try the left side up again.
So long as it's very gentle, this may not cause any severe damage and might be safe. How exactly it would work, I don't know, and I'd worry about using high pressures, generating high pressures against the facet joints, but we don't often see damage from this kind of treatment. Next one, again, this is an adjustment with the hands, and that seemed to be quick, and the forces here applied to these structures don't seem too large.
Take a deep breath in.
There's often an emphasis in these videos about how loud the crack is, and I think it's quite likely that there's a placebo effect as well in the patient and the practitioner being happy when there's a good crack, and that may be part of the, at least psychologically, part of the benefit of these treatments. Patients will often tell me that they do feel relief, but that the relief only lasts a short period of time. In the studies, that people do describe an increase in stiffness and pain and tenderness in the area, which most patients will actually report, but which is short-lived. There is a fair body of literature that looks at how effective spinal manipulation therapies are. Most of the studies have been rather small and of low to medium quality at best, so we don't really have large, robust randomized controlled trials. But there have been some smaller randomized controlled trials, and there have been many smaller studies, and there have been several systematic reviews, including Cochrane systematic reviews, which are very good reviews of the literature, done a few years ago now. These suggested that overall spinal manipulation therapy is associated with only a small effect, typically pain reducing on average by about 1 on a scale of 1 to 10, and lasting for a few weeks, and only very small benefits in terms of the function. And overall they found that these therapies were not more effective than other therapies, including painkillers and physiotherapy type treatments. So let's see a couple of shoulder treatments. And in this first one, you see some pressure being applied with equipment to the front of the shoulder. These look like small continuous applications of pressure, and the next one is something similar. You'll see some multiple applications of pressure. There's obviously some initial pain while this is being applied, and getting some deep tissue release. The science or quasi-science that chiropractors have for explaining the effects of these treatments is not actually validated, and as a rheumatologist, I can't reassure you that these are scientifically based, that we understand why they might be helping or for how long they're helping, or that we have a true grasp of what the adverse effects and complication rates are. There clearly are complication rates, but then the truth be told, there are complication rates even with physical exercise, as we know. I would particularly be careful about large forces applied to the upper spine and the neck, and to use of these more extreme techniques, which can really generate very fast and hard twists and turns. And as I say, there are multiple cases described of serious complications, discs, arteries, nerves being damaged, and bones can also be fractured. So I think it's important to be careful. Overall, the efficacy of these techniques is low, but they're often being used for patients who can't get much from traditional medicine, meaning that we often can do little more than prescribe medication and recommend physiotherapy, advice on posture, exercise, range of movement. But those are probably a better long-term strategy. These types of treatments can help people in acute pain to get out of it, and in that respect they can be very helpful, but by and large the effects are small and relatively short-lived. I'm not saying they don't have a place, but I think one needs to be aware of the potential risks, particularly of the more aggressive style of treatment, and particularly if the patient is less robust than some of those seen in this video, and for older patients who may have lower bone density, may have arthritis that restricts movements, which the practitioner may not be aware of, going ahead with these kinds of mobilizations can really pose significant risk. For example, patients who might have an inflammatory arthritis of the spine, which may be the cause of their spinal stiffness, could really suffer a fracture if the spine is then mobilized by someone like this when they haven't undergone basic investigations such as MRI. And therefore it's important that patients who have long-standing symptoms are first investigated, and that's really where rheumatologist comes into his own, checking whether there may be an underlying autoimmune process causing the symptoms. Generally we go for a more medical approach, which is still conservative, but if there's a well-localized pain in the spine, we may be able to identify that using modern imaging. That could be MRI, it can be SPECT CT, and then can, if the circumstances are correct, for example, have an imaging guided injection to that targeted point, which is often an irritated facet joint, for example, or sometimes a crowded nerve root. So I think we sometimes end up with a very well targeted treatment for a similar problem to the chiropractic examples that you've seen here, and perhaps the safety element is more enhanced and taken care of with these more traditional medical approaches. Having said that, clearly there's some role for spinal manipulative therapies, particularly the more gentle sort, for people who are in acute pain and don't find relief elsewhere. All right, thanks so much for watching, and feel free to subscribe. Thanks.